they don't get tested, they can pass it on, but they're part of the infective numbers. And so we don't know how risky it is, because when you think about it, more people die from influenza than die from Ebola. But the reason that is not because Ebola is less deadly if you get it. It's simply because so few people get it. If we look at the best studies that are out there, and those I believe are from South Korea, they have a huge number of test kits, and they decided, unlike the United States and Europe, to use a test kit that has a very high accuracy. It's reported to be about 95% accurate. And they've tested over 1 million people. It appears to be that the death rate associated with this, the mortality rate, is somewhere probably around, don't touch your face, probably somewhere around 0.5%, 1 in 200 people. Now, those 1 in 200 people represents about 5 times the death rate associated with the flu. So it is definitely more lethal, but it's more lethal than something that is relatively not lethal, not very dangerous. Nevertheless, because of the fact that you're talking about huge numbers of potential infected people, the impact it's going to have on the world and on the world support system, the hospitals and the medical community, is going to be a problem, because a much higher than 0.5% mortality rate involve people that need hospitalization, need ventilators, ICU care. And so if you're going to get the infection, it would be good to get it when not everybody else is getting it. In other words, the rest of the community is able to support you. That's part of the argument behind quarantining and trying to slow the spread of the disease, because we have a greater amount of duration over which we can spread our resources in order to give you the kind of care you need. Now, if you do decide that you want to try to eliminate your risks, you want to try to eliminate your contact with other people, and that means sometimes staying at home if you have the option, or maybe just minimizing the number of times that you are in contact, like going shopping.